And if there are dramatic cuts, for example, my husband's pension after his death as a longtime professor at Berkeley, I would be in great need of Medi-Cal. What will happen to the home health care services for older adults who are either living in assisted living facilities, otherwise known as nursing homes, or isolated in their apartments or housing? How are older adults, Michael, being cared for by Medi-Cal now, and what will happen to us?
I think my area of expertise, but
I know you're a children's advocate.
Medicare is the program for older adults. However, Medicare does not cover nursing home coverage. So many seniors get some of their care through Medicare, but actually rely on Medicaid or Medi-Cal to pay for that nursing home care, which we know is so important. So it's critically important for seniors.
And Dr. Q, do you want to, I know you're a pediatrician, but as a healthcare professional, what will happen to older adults, and particularly Vietnamese who came in the 70s and still, thankfully, are with us?
So according to, I have here, it's in Vietnamese only, but I have listed many acronyms of the different organizations that are supported by Medicaid, and I'm sure that all of you will recognize many of them. One, for example, is called PACE, which is specifically for the elderly, and he picks them up and takes care of, they have centers and facilities where they make sure that they get preventive health. Many of the portions of the Healthcare Act, and for example, the maintenance of health is at some point is not covered by Medicare, so but Medicaid picks up the difference. So as you get older and there's more disabilities, Medicaid fills in all the gaps.
It is a safety net.
Absolutely.
Okay, great. Any